If you take Ozempic, semaglutide, or Mounjaro, tirzepatide, a sick day can change the plan fast. The shot is not always the emergency. Dehydration is. Vomiting, diarrhea, fever, or not eating or drinking enough can make the next dose unsafe. Your next dose should depend on fluids, red flags, and your prescriber's plan, not just the weekly schedule. A sick day changes the rules because your body is already fighting an illness. You may eat less, drink less, and still lose fluid fast. These drugs can also make nausea feel stronger. On top of that, they slow how fast your stomach empties, meaning food can stay in the stomach longer. On a normal day, that effect may feel manageable. On a sick day, it can make symptoms stack up. Nausea, vomiting, and poor fluid intake can feed each other. That is why the next dose should never be judged by the calendar alone. The safer rule is simple. Check whether you can drink, urinate, and stand normally before thinking about the next injection. A dose decision without that check is incomplete. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Dehydration means your body has lost more fluid than it can safely replace. Vomiting and diarrhea can cause it quickly. Fever can make it worse. Warning signs include dry mouth, dark urine, very little urine, weakness, fast heartbeat, or dizziness when standing. When those warning signs appear, a pause is not the same as quitting. Many people worry that missing one dose will ruin progress. That fear can push them to inject during active vomiting or diarrhea. But weight loss from dehydration is not fat loss. It is a warning sign. Kidney stress is the next concern. Your kidneys filter waste from the blood, and they need enough blood flow to work safely. Severe fluid loss can reduce that flow. That is why repeated vomiting or diarrhea on these drugs should not be treated like ordinary inconvenience. This kidney risk is easier to miss than people expect. The medication may already make you less hungry. During illness, that can hide how little you are taking in. A person may say, "I am not hungry anyway," but eating and drinking too little plus fluid loss can become dangerous before it feels dramatic. The safest plan is written before illness starts. Ask your clinician what to do with injections, diabetes medicines, and blood pressure medicines during vomiting or diarrhea. Water pills are diuretics, medicines that make you urinate more, so ask about them too. This does not mean Ozempic or Mounjaro are forbidden. It means the sick day plan should fit your risk level. Fluid loss is not the only sick day problem. Diabetes adds another layer. Illness can raise blood sugar even when you are eating less. Blood sugar is the amount of sugar circulating in your blood. If you use insulin or other diabetes medicines, follow your clinician's sick day plan for checks and dose changes. Low blood sugar can also happen, especially when food intake drops. Symptoms may include sweating, shaking, confusion, hunger, or weakness. If you use insulin or a sulfonylurea, ask ahead about sick day dosing. A sulfonylurea is a diabetes pill that can push insulin release. Ketones are acids your body can make when it burns fat under stress. Some people with diabetes are told to check them during illness. If your plan says to check ketones, do it. If ketones are present or blood sugar stays very high, call for medical guidance. After blood sugar checks, the dose itself still matters. Symptoms after a dose increase deserve extra attention. Dose escalation means moving to a higher dose. If vomiting, diarrhea, or not eating or drinking enough begins after escalation, contact your prescriber early. Dose increases deserve attention, but certain symptoms are urgent at any dose. Severe belly pain is one of them. The pancreas is an organ that helps with digestion and blood sugar control. Pancreatitis means inflammation of that organ. Pain that spreads toward the back needs urgent medical advice, especially with vomiting. Gallbladder pain can also confuse people. The gallbladder stores bile, a fluid used to digest fat. Pain under the right ribs, fever, yellow eyes, or repeated vomiting should not be dismissed as normal nausea. Rapid weight loss can also increase gallstone risk. Other danger signs should also override the weekly schedule. fainting, confusion, breathing trouble, chest pain, or very low urine means home monitoring is no longer enough. Those symptoms should move the decision toward urgent care, not another injection. Beyond specific warning signs, some people should call sooner. Older adults, people with kidney disease, and people taking water pills need extra caution. These medicines can make fluid loss more dangerous. Blood pressure medicines can also matter during dehydration. Once your plan is clear, start home care with small repeated sips instead of large drinks. Oral rehydration fluid can help replace water and salts. Salts are minerals like sodium and potassium that help nerves, muscles, and circulation work. Avoid heavy, greasy meals until your stomach clearly settles. If you have diabetes, ask which fluids fit your sick day plan. While you are trying fluids at home, keep a short sick day note if symptoms are changing. Write down your last injection date, vomiting or diarrhea episodes, fluids taken, and urine changes. Add blood sugar readings if you check them. That record helps your prescriber understand the pattern and choose safer next steps. If you call, be specific about timing. Say when symptoms started, when the last injection happened, and whether symptoms followed a dose increase. That information can change the safest advice. A written note helps your clinician, and another person can help you act early. If you live alone, do not wait until you are too weak to ask for help. Tell a family member or neighbor if vomiting or diarrhea continues. If dizziness, confusion, or very low urine appears, getting help early is safer than trying to sleep it off. These home steps are meant to make the next call clearer. They do not replace medical advice when symptoms are severe. If fluids fail, urine drops, or confusion appears, the decision has already moved beyond home monitoring. If you cannot reach your prescriber and red flags are present, do not wait for a portal reply. Use urgent care or emergency services based on severity. A delayed message is not a safety plan during fainting, confusion, chest pain, or very low urine. Before the next injection, use this simple check. If symptoms are mild and fluids stay down, monitor closely. If fluids do not stay down, pause the next dose and call. If red flag symptoms appear, seek urgent care instead of waiting. Once symptoms are improving and you are stable, restart becomes the next safety decision. Do not restart casually after a longer break. Ask your prescriber whether you should resume the same dose or step down, and do not double up because you paused. Taking extra medicine to catch up can make stomach symptoms worse. If the gap was long, follow the product instructions and your prescriber's plan. The shot is weekly, but dehydration can change by the hour. Sick day rules are not a punishment for using Ozempic or Mounjaro. They are a safety break. You are protecting the conditions that make treatment work. Safe treatment means matching the dose to the illness, the fluids, and the warning signs. Progress matters, but safety decides whether progress can continue. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.